Good morning, everybody. I speak and the music goes away. Good morning.
Morning.
My name is Chris Wright. I'm with John Snow Incorporated and very pleased to be here chairing today's session. I hope everybody had a good evening and got out to their tailors and for their second or third fittings. I would like to point out, and I'm going to embarrass him right now, which is actually impossible, but I'd like Andrew Brown to stand up for just a moment and model his brand new suit. Take a walk down the catwalk, please. Okay, we won't do that. Okay, today's theme is managing the system. Human resources for supply chain management and data for management, including LMIS. So keep in mind that these two themes are very closely linked. People are the sources of data for management decisions, and people must also have the skills and capacity to use data for management decisions. In well-performing supply chains, the interdependence between people, processes, technology, and infrastructure are essential. But for our purposes this morning, people are at the heart of it. They carry out the processes, they collect, enter, manage, and analyze the data, they use and maintain the physical infrastructure and assets. Now, we've already talked about networks and optimization on Tuesday. Yesterday, we explored cold chain technology. And so today, we are looking at both the human resources and the data, so that then tomorrow, we can bring it all together. A note to our speakers and our questioners that our streaming video team would like to mention is that all of the microphones are live. That means they're on. So if you're going to talk amongst yourself, please do so far away from the microphones because they will pick you up and stream you globally. Okay, so another note is please remember that there are many posters downstairs on the first floor. You have to go down to the next floor down and then take the escalators. Today there are going to be some posters presented on human resources for supply chain management and data for management in the project gallery, so I encourage you to visit those during break times as well as, of course, the Innovations Cafe. The poster gallery doesn't seem to be getting a lot of traffic. It's downstairs in the London room, so please visit if you haven't already done so. Starting off today's sessions, we will be looking at global activities influencing human resources for supply chain management. That's been a topic that we've touched upon on a number of occasions over the last few days, and so we're going to go more in depth and explore both the global aspects of it, what's happening at the global stage, as well as hearing from a number of countries this morning that are taking different approaches to strengthening human resources for supply chain management, including immunization supply chains. We'll be hearing from Vietnam, Myanmar, Laos PDR, and India. This afternoon, we'll continue with breakout sessions on some of these themes with additional country examples and exploring the areas of strengthening supply chain leadership in the countries, the role of national logistics and supply chain working groups, teams of people, and how to improve the EVM tool in the area of HR capacity building. So I encourage you all to come out to these sessions this afternoon. After the coffee break, we'll turn to the data aspects, the logistics management information systems and data management more broadly with global updates and country innovations. And again, there will be breakout sessions that I'll touch upon later. So to get us started, we're going to look at the global perspective. And I would like to introduce our two speakers, Andrew Brown. Stand up, Andrew, again. I'm picking on you. You're not going to stand up. Okay. Andrew has the role of executive manager for the People That Deliver initiative. He's been with them since June 2013. He'll be wrapping up, unfortunately, in June 2015, but we hope to see him around more. He's been working globally to engage international organizations and country governments to strengthen their systematic approach to cadres involved in health supply chains in the development context. We'll also be hearing from Musonda Kasonde, who is a supply chain specialist with the UNICEF Supply Division in Copenhagen. She focuses on supply chain system strengthening and capacity development with governments across all programs. She's got over 17 years experience in procurement and supply chain management in both the public and private sectors, having previously worked for organizations including UNICEF in Nigeria, UNICTR in Tanzania. She's also worked for Nokia, Ericsson, and is a management consultant for Capgemini Ernst & Young in the UK, where most of her time was spent on a project in the low-resource environment of the National Health Service in Scotland. Sorry, that was just a small dig. And so, to get us started, we'd like to start with Musonda, who's going to take us through aspects that UNICEF is working on with Gavi on HR for SCMM.
Thank you, Chris, and good morning to all. So throughout the conference, we've heard about HR issues and how cross-cutting HR is and how it touches upon pretty much everything in the supply chain. So pleased to be finally kicking off the discussion and having a more in-depth conversation around HR. So as Chris introduced, I'll be touching upon some of the activities we're working on a global level to move forward the agenda on HR and try and increase the focus on HR. I'll be speaking specifically about the work within the Gavi Alliance supply chain strategy and the people and practices focus area. So just to set the context, in essence, the background and where this is all coming from. The origin is the immunization supply chain strategy that was recently developed by the members of the Gavi Alliance. And a key component, naturally ones with all the consultations and the evidence gathering, a key component of this strategy is looking at the HR side of things. The strategy, in essence, responds to all the evidence. Some of this has already been presented. The poor performance that is demonstrated by the EVM scores, by the increasing expense and complexity surrounding the supply chain due to the introduction of new vaccines and the impact that will have in the years going forward and the impact that it is currently having. And as also part of our data gathering and our evidence, we did a sort of study, a review to collate the evidence and validate the hypotheses we had around HR. And the issues are not uncommon, are familiar with all of us. It was the inadequate training, it was access to knowledge, there were issues around performance management, so it's nothing new. But in essence, this is what we were reacting to and trying to move forward to help to resolve some of these issues. The strategy has 5 fundamentals. One of them, as I mentioned, being HR, but just to set the context, I'll just touch upon the other 5. I think we'll have a more in-depth discussion on the strategy tomorrow. Supply chain leadership being one of the key fundamentals. And then we have data for management, cold chain equipment, planning, continuous improvement planning, and system design. So pulling out the leadership aspect, the supply chain leadership, in essence, this is put first, because before anything can happen, we need somebody in place to conduct all these activities, to work on improving the supply chain. So this is a very key fundamental and the first one that is listed here. So we need the supply chain manager who then needs a plan to be able to manage the supply chain, who needs data to be informed on what is happening, to be able to track performance, and then the equipment and the system design come hand in hand with that. digging even deeper into the HR, into the HR component. The strategy is structured around different working groups. And the working group that I'm involved in, that I've been coordinating, is the People and Practices Priority Working Group. And the goal, I mean, we have this vision, we have this goal for 2020, in that all countries have dedicated and competent immunization supply chain leaders with adequate numbers of skilled, competent, accountable, motivated, and empowered personnel at all levels of the system to overcome the challenges that are being faced. So an ambitious goal, but we're very optimistic, and we hope that what we're doing is helping us to get there. The working group is focusing efforts on a number of areas, sharing expertise, building capacity, and trying to facilitate access to resources for countries. So within that, we're developing some guidance to support countries to go about the whole HR process and conduct assessments, etc. Trying to introduce new platforms so that data is, knowledge and training is more readily accessible in different formats, moving away from some of the traditional methods of training. Capacity development, so building up supply chain managers at all levels and supporting countries to, with that technical assistance to build capacity of those who are responsible for the supply chain. And then looking at some of the other supporting tools, like performance management tools. And a big thing we're trying to address is the change management side of things and how to institutionalize practices. I'll just speak about one of the key deliverables for this year, is to pull together a country support package, an HR country support package for supply chain managers. And within this, the first thing, and probably the most, the biggest thing within this package is looking at the EVM. So incorporating an increased focus on HR within the EVM. So this is about defining standards and KPIs that will eventually be integrated into the EVM process, so that HR plans, there's a stronger component of HR plans within the EVM improvement plan. And then to support that, there's a competency framework, and this competency framework will serve to map roles to required competencies, so one can look at one's organization and identify the sort of skills that are required for each function, and then map that to the role, and also you'd be used to identify gaps and thus develop a plan to fill those gaps. And then looking at TORs and profiles of supply chain managers, both in the private and public sector. So just to know what is typical, I mean, what works well, what isn't working, so we can learn from that, from both from the private sector as well. Once gaps have been identified, support to developing a plan for professional development, hoping that this will also cover issues around motivation, when people can see where they're starting from and where they're going to. And as part of that, a leadership program is being developed, supported by UPS, who are developing a leadership program for supply chain managers to try and strengthen some of the skills around management. And then we recognize that there's an enabling environment and that stakeholders need to be involved. So how do we engage the stakeholders? Some guidelines and a framework around that. And then change management to try and institutionalize some of the practices. Because a lot of it we know is not about not knowing what to do, but how do we comply with what we need to do and make it business, just make it a natural thing and business as usual. Performance management, again, guides, references to support in performance management. And then hopefully bringing that all together within a HR strengthening and capacity development plan a plan that is integrated into the EVM improvement plan or other immunization supply chain strengthening plan. So essentially, with this package, where the hope is that all countries can say, at least this is when we we have a big tick in the box, is that all countries say we have a dedicated supply chain manager with clear responsibilities and accountabilities for managing the supply chain. We have assessed our HR for logistics and understand who is doing what where. We have mapped the competencies required by each role or function and identified the gaps at all levels of the supply chain, and we know who needs what capacity development where. We understand who needs to be influenced and what is needed in the enabling environment to create a conducive work environment and to empower staff so that they are able to deliver. We understand the issues and opportunities around change management that is required to institutionalize compliance and good practice. We have developed a mechanism to continuously monitor and improve performance. And finally, all of this is articulated in an HR strengthening or improvement plan. And to support that, there are also other areas that we're looking at within the sort of enablers, looking at engaging the private sector, as has already been done with UPS, where they're helping to develop the content on the leadership program. Some of us may have heard of the Regional Centers of Excellence, Logivac, and the upcoming Center of Excellence in Rwanda, which I believe will be presented at some point as well. Looking at the advocacy and communications, we're developing some tools so people can use to advocate and raise awareness, increase the profile. And then the supporting mechanism, the National Logistics Working Group, we feel are key to supporting the workforce in coordinating all the work around the supply chain. Issues around the enabling environment, the system, what needs to change within the system. And then naturally providing technical assistance. So not only saying that this is what needs to happen, but supporting actually hands-on support to what needs to happen. I'll just highlight that this is not a one-man show. It's very much a cross-agency collaborative effort. The working group has a number of members from different agencies within the alliance and out of the alliance, and we even have some donor agencies as part of the working group, all providing that expertise, and a member from the private sector as well. We'll be hearing from Andrew just after, but just to highlight that he's also a member of this working group. So with that, I'll say thank you from the real sponsor of this conference, and I'll hand over to Andrew to continue the presentation.
Put your hand up if you ever wanted to go to London. Who's really, really wanted to go to London? Come on, don't be shy. To see those people in the red suits with the fluffy hats. Did you realise that at this TechNet Conference in 2015, you can go to London? The London room is downstairs and is the home of a range of posters and the project gallery, and we're going to be there at lunchtime giving you an extended explanation of some of these HR activities. The reason I say that is we only have about 10 minutes today to introduce to you a complex topic, and so within 10 minutes I want to capture your imagination to realise that the complex issue of human resources can be addressed, and that there are a number of agencies internationally working together under the People That Deliver initiative to help you achieve that. Very quickly, these are the issues that I'm going to touch on, but more importantly, link you to some resources that will enable you to look at this more deeply and to consider how you can work with country partners for change to happen in the country context relating to human resources. For those of you who are involved in the broader Human Resources for Health initiative, you'll be familiar with the report on the screen. This was produced in 2006, 4.3 million health workers globally missing. If you note the map on the screen, the intense orange is the countries most affected by this health worker shortage. In the little writing, you'll see that 1.9 million staff that are missing are management staff, including logistics and supply chain staff, in order for our health systems to run at what WHO consider to be an appropriate level of care. What is unfortunate is in 2015, these numbers have increased and not decreased. And so our problem has become more urgent. And Musonda helped us to describe some of the extra pressures that are on the immunisation supply chain, but these pressures are on health commodity supply chains more broadly, and something we need to be looking at. So when we're talking about human resources, what are we talking about? Often in a discussion in a supply chain environment, a human resource discussion begins with a discussion about training and ends with a discussion about training, without thinking of the broader context in which human resources must be systematically placed for a sustainable work environment. On the screen is a desired paradigm that people that deliver is working towards. A paradigm where we have qualified staff hired for supply chain management positions, there are career incentives, there's staff satisfaction, there's a desire to be a supply chain professional in a country context, and that national institutions, including governments and also private sector, where these are outsourced competencies, is to make sure that these people are desired. And this is a paradigm that needs a long-term focus and requires capacity development that accumulates over time, and this is often not what donors want to hear, and often what governments are finding difficult in a resource-constrained environment. Put your hand up if you had a job interview for your current job. Okay, keep your hand up. Keep your hand up. Make sure you're looking around at people. Keep your hand up if in the last 12 months you've had a performance appraisal. Okay, excellent. Put your hand up if in the last 12 months you have... Keep your hand up. We can swap hands if you're getting tired. Keep looking around. Keep your hand up if in the last 12 months you've undergone some training, internal training that was organised by your employer. Okay. Now keep your hand up if you are employed by a government and look around. Did you notice all the hands drop? What we want people to be thinking about is about, you can put your hands down now, thank you for your enthusiasm. We will take questions later and some of those can be transmitted electronically, so watch out for that. On the screen are 5 building blocks. If you're engaged in human resources, these will not be unfamiliar to you. So within human resources, we need to talk about engaged stakeholders. Now these are the leaders that Musonda was talking about, and People That Deliver is very excited to be engaged in the Garvey People in Practice Working Group because of the focus on that leadership. But engaged stakeholders also means bureaucratic leaders within the Ministry of Health. Are they listening? Do they understand about supply chain, about the investments that are needed? Optimising policies and plans. Is there a human resources plan for the supply chain organisation looking after the supply chain? In terms of numbers, in terms of the policies and plans for onboarding staff or providing those interviews? Are the right job descriptions in place? Is there performance management tools, which is block 4? Block 3 is workforce development, not only in-service training but also pre-service. In some of the countries we work in, there is huge disparity between the education given at an undergraduate or even a graduate level for people who are currently in the supply chain compared to the competencies they're asked to do. Increased performance management and retention. We often hear, I'm not going to train people because once I train them, they'll go to the private sector. If you're interested in human resources, you'll understand that the World Bank is suggesting we take a whole-of-market approach when it comes to looking at strengthening human resources. And in Africa particularly, there's an increased demand for supply chain professionals. So if we just focus on the government sector only, we're still going to have some shortcomings, so some challenges. And also professionalisation. How do we increase an understanding that to be working in supply chain requires a set of competencies that you don't just gain from just being there. You need to learn them either on the job or from training environments. And these 5 building blocks are interrelated, and often our conversation is only in that middle building block about training. We want to encourage the conversation to go wider. The People That Deliver initiative was launched in 2011 with a large range of partners, now more than 80 organisations. The white writing on the screen indicates that we have a large interaction with a range of constituencies, and by the terms of reference of our initiative, all of those constituencies are represented on the board. And for interest to you is in October this year, there will be new elections for the board of People That Deliver, if your organisation is interested. Currently on the screen are the current board members, which include 4 country governments, Indonesia, Burkina Faso, Namibia and Sudan. So we're looking for that interaction at the country level. We have 7 focus countries which were chosen at our initial conference. These focus countries were where government delegations came and signed up to commit to an interest in this area, where donors gave significant funds to progress activity in these countries, and technical partners were present. Although we have focus countries, the People That Deliver initiative works with any governments or organisations that come to us with requests. Just quickly, I want to talk about our 4 goals and what we've achieved, and refer you to our website, which is www.peoplethatdeliver.org. And to help you to remember that, at the back as you go out, you can get a little luggage tag, because I know, like me, you've bought something extra while you're away, and you need a luggage tag in order to identify your bag. These are available at the door if you'd like one. Back to our goals. The first goal is global recognition. So we've worked with a number of international programs to ensure that human resources for supply chain is on that radar. The Gavi initiative with the Gavi supply chain strategy is a significant one. The initiative is sponsored with funds from USAID, UNFPA and Gavi, but we are generously hosted by UNICEF Supply Division in Copenhagen, where our secretariat resides. So we've had a great opportunity to be engaged globally, and I'm sure most of you in the room will receive at least one email from our project every 2 months or so. More recently, because we're releasing some interesting documents. Global government interaction and action. This is where the initiative is going to be measured, is what changes are going to happen at the country level. And this is where we need the help of all of you working in country. People That Deliver is 2 people paid positions, myself and Sarah as an assistant. All of the activity that occurs under the People That Deliver banner is from our membership. And it's fantastic when our members come together for this activity. What we know from our country interaction is that interaction takes place where the governments are committed, where there's funding available and partners are working together. And if you listened to what Musonda said before, this is the framework within which the Gavi strategy is based, about leaders working with supply chain groups, and with these supply chain groups coming together to form plans of action supported by partners for country context. Adequate trained personnel. So yes, I am happy to use the training word because it's important, but don't use it without thinking about the broader context of human resources. On the screen are a range of projects that we've been involved with to help improve competency development in different institutions. Some of those are in lower level cadres, assistants or storekeepers, and a number of them are involving leaders through master's degrees. I will highlight the bottom item, laptop. This is an interactive web platform that is organised through the Reproductive Health Supplies Coalition, and is a place you can go on and you can investigate what supply chain training courses are available across the world, and it's in 3 different languages. This particular website gets 10,000 hits a month, just to give you an idea of the demand that's out there for supply chain education. The 4th goal is tools and resources. And this is where I want you to look at the table in front of you, and you will see that there is this paper. So please make sure you can find it. I'm going to refer to that in a moment. But we've been very active with our partners over the past couple of years to develop a range of tools. We have a suite of advocacy tools ranging from these 2 pieces of paper which explain who People That Deliver is and what it means to make changes in your human resources. These two are also available at the back door as you go out. We also, for Advocacy Tools, have videos that you can use to help to advocate for these changes, and a workshop that you can run. Assessment and planning. There is a Human Resources for Supply Chain assessment guide and toolkit that's been used in 15 countries to generate operational plans around those 5 building blocks. Competency mapping. We've worked in Namibia to have great guidance on how to map the competencies of supply chain staff and how to then use that to modify job descriptions and training opportunities. And we also have a funding guide for supply chain managers to look at the range of international funding opportunities and how to access them. I'd like to come back to this tool, and in the next 24 hours you will note that the people that deliver bi-monthly newsletter will be released, and in that newsletter will be a hot link to get an active version of this. What we've learned from our country engagement is a 4-step process to systematically improve human resources. Those steps are listed on the screen and are noted on page 3 of this handout. Obviously, I'm not going to go through this now, but if you are interested in making changes regarding human resources in your country context, this would be a document I would refer you to. And note that all of those links on all of the resources in this document are live and will take you to the full documents. In concluding, I want you to note that you can be engaged in the People That Deliver initiative. On the screen is a number of ways that you can do that. And I would encourage you to contact our website. Also, this afternoon, of course, we'll be in the London room and around for today and tomorrow. So if you have any further questions or want to engage with us, let us know. But why do we want to do this? Why is it important to concentrate on human resources? We've noted that it's an important backbone of a service delivery within a supply chain. But at last, someone has recognised that the work of supply chain team because our superiors never do. And this particular message is coming to us as the People That Deliver initiative from many countries around the world and coming to us in many languages. So with that, I would like to encourage you to improve your focus on human resources, but do so by working with partners and really considering how you can engage with country governments to make change. Thank you.
Thank you. Thank you, Andrew. And again, I would encourage you to take a look and and make use of this document. It's a very comprehensive listing representing a good 4 years worth of work that has gone into compiling tools, evidence, and advocacy tools for this area. Okay, so that's what's going on the global level. We're not going to take questions right now. We'll wait until after we hear from our country experiences. And so jumping right in, I would like to introduce Dorothy Leab, who is in charge of AMP's Human Resources for Health program and is the director of AMP's Vietnam office. In these roles, she's managed AMP's efforts to tackle the health workforce crisis in both Africa and in Asia. At AMP since 1994, Dorothy has worked in a range of areas, including immunization workforce capacity building, policy advocacy for increased funding for immunization and vaccines, and in information, education, and communication package design. So she's got quite a range of expertise, but each of them with very much a human focus. Dorothy?
Thank you very much for the introduction. Good morning, everybody. I'm very pleased to be here and would like to thank the organizer to invite us to share about Vietnam experience. I think it was a very, very inspiring presentation this morning from Musonda and Andrew. This presentation is really to provide some ideas and experience from an INGO based in Vietnam. So the idea is really to share with you how all these global recommendation guidelines tools could be utilized in Vietnam. And the key point is really to consider that I would like to make just a small comment about the fact that when you present the training opportunities and all the tools, I think it would be very good to really allocate much more consideration and work in Southeast Asia, because it seems that all the training opportunities at the chair were really focused on Africa. So I would like to really advocate. I think it's a room for that. Thank you. So just to move into the situation of Vietnam, I don't know if you know Vietnam, but Vietnam is a very beautiful country, but not only. Since 1985, Vietnam has introduced the expanded program on immunization. Today, we can consider that Vietnam has made remarkable progress in terms of immunization coverage. You can see on this slide the list of the vaccine introduced currently in a routine base in the EPI. We can consider that the last year there were very good progress, and you can see that the immunization coverage is more than 90%, and there was a progress from 2013 and 2014. However, I can say that Vietnam is facing a transition phase. So Vietnam is a middle-income country, as you may know, and in 2015, Vietnam will be graduating from Gavi support. In the same time, they are still facing some issue regarding the maintaining the EPI achievements, more than 90% national immunization coverage. Also, the idea of co-financing, moving from co-financing to 100% financing, and continuing supplying EPI vaccines and materials. I think that it will be very tricky after 2015. And still, Vietnam is facing disparities in immunization coverage. So when you look at very, very specific areas, such as ethnic minority groups, mountainous area, you can see that the immunization coverage is much around 60%. The other thing is the human resources for EPI. So there are many staff involved in immunization, and currently there is only face-to-face training courses to enable the staff to be to deliver the immunization services. So there is a need probably to see how we can change the way to train the staff. And the other thing is the vaccine supply chain management that is repeatedly considered as a weakness and something to be really reinforced. So when we look at the figure, immunization coverage very high, but still Vietnam is facing outbreaks. Measles outbreaks since 2013 until now, and some severe A5 with baby deaths. So this is somewhere unacceptable. There's something to be done really. And I would like to focus much more the discussion around human resources for EPI and vaccine supply management. When we look at the distribution of the vaccine from the national level to the villages, we must consider that in Vietnam there is a specific situation. When you look at the 9 vaccines in the EPI, you must consider that in fact 7 out of the 9 vaccines are locally produced. And then the distribution is done to the regional level, to the provincial level, district level, and then commune health stations. The thing is that there are many staff involved in this process. Almost 12,000 staff are involved in the distribution of vaccine and administration of vaccine. Fortunately, it enabled Vietnam to vaccinate almost 8 million under 5 children. So when we look at the human resources for immunization and supply chain management, there are nearly 12,000 staff involved. And we were just thinking about how far they are skilled to implement supply chain management or immunization logistics. There is currently no mapping of the existing staff involved. We assume that most of the time they are not allocated 100% to work on these topics. So we assume that they are maybe, working in other areas, not only in vaccination and so on. So we're just thinking about how to ensuring that specialized staff could be able to deliver and to store, to transport the vaccine until the facilities. At commune level, in fact, there is no medical doctors, so most of the time it's a very few number of staff at commune health stations. So the idea was to see how far we could really move into task shifting from the upper levels. What about cascade training? I think that in Vietnam there is currently no cascade training. Most of the training are organized by the central level, so there is really something to be reconsidered probably in terms of human resources development. When we look at the situation of Vietnam, in fact, there is no supply chain manager, there is no supply chain personnel, there is no professionalization of human resource for supply chain management and immunization logistics. And probably the tricky components in Vietnam would be to start with a policy dialogue. So we know that Vietnam is very interested by the evidence, best practices from other countries. So probably we could help advocating, utilizing the evidence-based approach or information-based approach. And we could, I think, really build on the national leadership and governance, because there is a strong leadership in Vietnam, so I think it's a very good point. And probably the human resources strategies or policy formulation could be influenced through this kind of advocacy campaign. And AMP is very, very keen to conduct this kind of advocacy activities. The second component is related to the partnerships. So in Vietnam there is a ICC, so I think it's good. But probably the question of human resource policy or supply chain manager and personnel should be also extended to other sectors. We should consider that probably we should work more closely with the education sector, with the Minister of Finance for sure, the public service, and of course the regulatory bodies that are the ones who will really detail how you are going to implement the policy, which activity and which right the health worker can demand. So for sure, professional association, NGOs, and private sector should be engaged in this process. And I think that in Vietnam, it's a perfect case study, I think, to demonstrate that this is possible. We have also good DPs. We have a specific group of technical and financial partners that could be involved in this process. And last, so we are talking about education and training, how to make real professionals of supply chain management. What we can do is that in Vietnam, regarding the policy dialogue, there is a room for starting something, because there is a strategy that has been developed, and which is related to the investment in supply chain management for disadvantaged area. And I think this is very good in the health sector. So the government will be committed to move into this process, but it did not start, so we must start somewhere, maybe with the advocacy campaign. And the second thing is that during the last ICC meetings, AMP shared information about this importance of supply chain manager and the fact that there could be support from Gavi, from people that deliver, from AMP and other DPs, which would be very happy to help Vietnam to move forward. The other thing is related to the education and training, and Andrew is very right for that, because in fact there are some different training programs, but for in-service and very specific to cold chain or transportation or something like this. But there is no comprehensive training program or education program, and probably there's something to be done.
Time. Time.
Yes, I will do it very quickly. So just to explain that for in-service and pre-service program, we believe that there's something to be done in terms of instructional system design, and probably the idea is really to start from the competencies. Which competency do we need at national, regional, provincial, and central levels? How far we can help empower the Vietnam to get these skills available at each level of the immunization system. The other thing is probably to see how far we could develop some specific supply chain management knowledge and sharing cloud. The idea is really to see how we could gather all the existing things, how to harness the utilization of the ICTs in this process, and how to build the capacity of training, national training institute to provide with education and training, how to build on the experience, existing good practices and so on. So we already experience this kind of tools, serious game, mobile job application, community of practice and e-learning. So the idea is really to see how we could build something comprehensive available for the supply chain manager. This is to complete my, to end the presentation. I just wanted to raise the point as INGO that very good immunization coverage in Vietnam, as you could see. However, we are still facing issues. 91 districts in Vietnam are still under 80% of coverage. So you can see on this map on red the location where babies are still not vaccinated, where babies are still dying from vaccine-preventable disease. So this is not acceptable, and I believe that partners will continue helping Vietnam to leverage all these barriers. Thank you.
Thank you, Dorothy. Just one note, in 2014, Dorothy received the 2014 Gates Vaccine and Innovation Award in recognition for her engagement on EPIVAC, which is an on-the-job training program for district medical officers to improve immunization program performance in 11 Francophone African countries. So I guess that was prior to your time in Vietnam, and congratulations on that. Moving on to Myanmar, Dr. Kyaw Kaung, I hope I said that correctly, is the program manager and deputy director for EPI in the Ministry of Health of Myanmar, and has over 15 years experience in public health and immunization. We've heard him speak already on other topics during the conference, and so we're delighted that he has also agreed to share his experience with us here on human resources. Doctor?
Good morning, everybody again. And thank you for giving me the opportunity to present on our country's situation, on how we have been planning for the HR and especially for the immunization supply chain. And as you know, this is the Myanmar National Medical Supply Chain Management System. And formerly, we have the departmental head. Now this departmental head has been we split into two units, two separate departments. And formerly, under the departmental head, there's a medical care division. And this medical care division is led by the directors, who is responsible for all the hospital services and in the around entire the country, and who will be taking care for the supervision and procurement and the supplies, especially for the supply chain for the immunization as well, and the others the curated commodities. And under the medical care divisions, there's a central medical depots, who will be taking care all the country entire the supply chain management for all the supplies, including the EPI. And this has been collaborating with our immunization partners, WHO, UNICEF, and Gavi, and their supply focus, the procurement, financial management, and the store control, warehouse control, and management has been taken care of by the deputy directors. And under these deputy directors, there's around the 50 staff who are managing the whole country, the supply chain system. And under this, the CMST, what we call is Central Medical Store, there's a regional sub-depot who has been taking care of the assistant writers and storekeeping, distribution, and the feedback and the supply chain for the whole country, management of the whole supply, including the EPI supply. And particularly, then the EPI vaccine store has been managed by the EPI, and these supply chains are the ongoing for the whole country, and these are what's the overview or what's currently we are working for, and related to the immunization supplies, this UNICEF, WHO, and the departmental head plays a major role, and the collaboration with the others, the partners like the GSI and others, the Gavi partners. And the UNICEF and the ministerial head has been taking care for the vaccine and logistic focus, and the procurement mainly from the UNICEF, and some of the custom clearance issue, like the clearance, it has been taken care by the WHO and from the department head, and also sometimes in case of the campaign, UNICEF assisted us for the special agencies and for make the supply the clearance. And we mainly taking care of the storage and the distribution at the national and the sub-national level by the ministerial head. And also the distribution has been taken care jointly by mainly by the Central Medical Store and also the UNICEF and the WHO sometimes has for these and the special activities. And the supply tracking, the monitoring has been mainly taken care by the permanent head and the INGO hairpins for this supply monitoring and the tracking. And the material flow, financial flows, and some information has been jointly taken care by all the three main partners of all the units of the supply chain system. And here are the challenges for the country that the main challenges as the immunization the program RC has been only taking responsibility by very few number of staff, including me and the other the 2-3 assistant writers. And so immunization program HR is also the challenging, and also the supply chain HR is also the challenging for making the supply chain very systematically. And there's a limitation of the HR capacity at the central level and the subnational level as well. And the lack of the proper logistic management training to this, the already assigned the staff. And also the supply focus at the subnational and the township level has been multiple tasks. That's all where that's in the setting of the developing country, all the duty has been taken all by only the same staff. And as for the infrastructure, there's a limited space at the national and the subnational level. The limited delivery facilities, and there's the reporting systems has been paper-based, and it's a manual system as well. And the supply chain management, the different procurement agencies and the different procurement mechanisms has been already, and so we need something. The integration should be think in the future the management of the supply chain. And this fragmented supply management by the multiple partners and the weak to follow standardized equipment and the other drugs has been challenging for us. And also the end user feedback not used for the future procurement, like we treat something like this supply are not good from the feedback, and this has been not taking care of action for the future procurement. And as for the funding, the last proportion to control from government, and the funding is not allocated by EP and Rally, but by the National Medical Supply Chain System Management has been running by the separate the funding system. And here's there's an opportunity. The ministry has now, as I mentioned earlier, we have in the reform process, and now we have to develop the new department and the supply procurement and the supply mechanism. And also it's sound like there's a good opportunity. This good opportunity means the challenges for the development of the new system, new designs, and new procurement and a new supply system. And the procurement and supply sessions, as new session has been created in the country, and the career ladder for the supply chain focus that we need to define and we need to develop. And there's another opportunity is the Gavi. Gavi has the current HSS grants, and now we are in the process of proposing the Gavi, the new HSS grants from 2016-2020. And this way we're supposed to support the EPI supply chain strengthening and the HR capacity strengthening with the Gavi supply chain strategy. And then send potential partnership with the Cheyne, GSI, UNFPA, USAID, and now we are working for the SCMS system. That will be helpful for the EPI supply chain and future the HR capacity development. And also allocation of the more government fund is a good opportunity for us. And using this, the more funding, we have to use the strengthening the HR capacity for our future supply chain system. And thank you very much for your attention.
Thank you, Dr. Kaung. Moving on to slightly east, we're going to hear from Laos PDR. Dr. Ataur Rahman is the immunization specialist at UNICEF Laos PDR. He has more than 28 years of progressive responsibility working in different capacities at the subnational, national, and international levels in public health programs. For the last 5 years, he's been working to support the government of Laos PDR in strengthening the immunization program, as well as the MMCH program. He's a member of the ICC Technical Working Group on Maternal and Child Health, the Technical Working Group for Supply and Procurement, and Human Resources for Health. Doctor?
Thank you. Good morning, everybody. So I will be presenting on behalf of National Immunization Program, Government of Laos PDR. So I feel it is very challenging to present on behalf of the government. But I feel very privileged to be here, and thanks to the organizer to give me the opportunity to present Laos PDR experience. Maybe who don't know where is the Laos PDR. So here is Laos PDR. Laos PDR is a landlocked country. 65% of the territory is mountainous. Population is slightly less than 7 million. So main service providers in Laos PDR is the government. Immunization service provided through fixed site and outreach services. And more than 70% of area population served through outreach services. There is no visible private sector or service provider. And the layers of supply chain, in 4 layers of supply chain, is at the central level, provincial, district, and health center level. And more than 1,200 stores. So what is the context of Laos PDR? The present context is there is very fast growing immunization services, new vaccines, new costly vaccines, more cold chain, new target groups. And just to give you one example how fast is it grow. In 2010, in country, in Laos PDR, there was only 250 refrigerators. In the beginning of 2015, now more than 1,200 refrigerators. So it increased 5-fold. But the human resources, I am coming later on. And also, there is new policy of the government. The government wants to have established cold storage in all the health centers all over the country. And also changing the country eligibility for overseas development assistance. So what does it mean? That now, from 2012, government has to use their own revenue money for the procurement of routine vaccines. So also, as country is graduating to lower middle income country, now the government has to pay more also for Gavi financing. And government, this fiscal space is very limited. And there is also the context, there is new technology, new opportunities, and the government also has new strategy on equity focused planning and programming. And just to give you another example of the context is, in 2013, the vaccine shipment was only 25 shipments in a year. It has increased in 2014, 45 shipments. In 2015, up to now, in 4 months, there was 28 shipments of vaccines. So you can imagine how it is growing and how much human effort is needed to manage all those shipments. So I will not go all those things. You already heard many times. Laos is not unique. All those shortage of human resources, workers are overloaded, limited trainings, all are there. So So what initiative taken by the government to manage all those challenges and especially for human resources? So in 2010, Laos PDR has established a new center called MPSC, Medical Product Service Center, under the Department of Food and Drug, Ministry of Health. So this is one center, created a separate center with designated supply chain staff to focus on overall policy development, implementation, and monitoring of supply chain management. And government also had a ministerial decree to make logistics system as one window system at the central level and also at the provincial and district level. And also government has identified a dedicated staff for supply chain management at the central level, province and district level. And also government has formed a procurement and supply technical working group, a formal mechanism for communicating and strategizing, where all the development partners, all the Ministry of Health, different departments are involved. So during last few years, also staffs, dedicated staffs, also the health worker who are responsible, who got additional responsibility to manage the supply chain has been trained on effective vaccine management and store management. And another good thing is in Laos PDR, the supply chain management is integrated in the pharmacist training curriculum. So I also will not go on this slide. So this is how Laos PDR has analyzed and prioritized the action. So on the area of leadership, managers, and health workers, and what are the issues they manage at the leadership level to manage the sustainable financing, planning, monitoring, at the manager level, management of information, communication, training, supervision, and the health worker level, training of logistics tasks. So what we see in 2014, what is the progress? In Laos PDR every year, with the support from UNFPA, also other partners, does the commodity survey. And we found that in 2014, the no stock out of vaccine and child survival commodities. If you compare previous years in 2010, 13, and 14, no stock out is 58%. Facilities where there was no stock out during the last 6 months before the survey date. So we could see a great progress here. But one thing we have to keep in mind that the previous two survey was done the external, so this survey was done internal. But at the same time, if we see the EBM assessment, we also could see that all 9 criteria, the scores was higher than the 2010 survey. Okay. So despite all those initiatives and support, we could see still there are continuous specific supply chain management. There are many supply chain management for EPI, for TB, for malaria, for HIV/AIDS, for family planning materials, still continuing the same silo supply chain management. And MPSC, which was great idea to have a central, it became like a warehouse management at the central level. So there are many challenges, but I will highlight only a couple of challenges and the opportunities. The first is the inheritance system issues. So here, all those issues of the recruitment, because in Laos PDR, mainly the recruitment process is every year, province get a quota. So how many staff province can recruit? So for example, one province get 10 quota, the 10 staff province can recruit. Then provincial government decide which department will get how many. So this is a very complex issue of this recruitment. And there are also challenges of retention of the trained staffs. So every year, at least 15 to 20% staff moved, either for new position or moved to another place. So those are the issues. There are opportunities also that government has increased recognition to need the workforce planning. The opportunity is now government is doing this health sector reform and human resource for health planning for next five years. Government also is developing now the health sector development plan for next 5 years. So all those human resources issues are included on those. And regarding funding, also there are the opportunities that integrated HR supply chain management is included in the will be included in the new comprehensive multi-year plan, EPI, for 2016-20. And the capacity building and human resource also has been included in the new EBM improvement plan and 8th health sector development plan. So there is another challenges what I mentioned that there are many different partners are supporting on this technology, different system of supply chain management like e-health, AMP supply, information logistics supply, LMIS, CCIS, so there is also an opportunity and willingness from the support for many partners to have now they are thinking to have one umbrella like e-health, so to use the DHIS2 platform for those information systems. So this is my last slide. So key messages. So what we would like to mention here that the main issue for Laos is the challenge is the management coordination. So this is one area in future we need to work on, and only increasing staff, training and technology will not solve the problem in Laos PDR until we also looked at the other issues of human resources, including the management and coordination. Thank you.
Thank you, Dr. Rahman. And last but not least, we're going to hear from India. Dr. Shahari Dutta is the immunization specialist at UNICEF India and working closely with the government on health system strengthening, including on initiatives to build a human resource capacity. He's a medical doctor and an epidemiologist with 21 years experience in EPI, including with WHO and UNICEF for polio eradication and routine immunization. He's also a teacher and has worked at different levels, district, state, national. For the last 7 years, he's been focusing on immunization supply chain and introduced VMA in India, developed the concept for the National Cold Chain MIS and VLMIS, amongst many other initiatives. Dr. Dutta is a strong advocate for health system strengthening and empowering government. Dr. Dutta, take it away.
Thank you very much, and good morning, everybody. So I'll be speaking on the journey of a 4-year journey regarding health system strengthening in India. This is my outline of my presentation, and the most important